Right now, somewhere in your kitchen, there is a small container sitting in your refrigerator that most people walk right past. They see it as a topping for cereal, a snack for the kids, something you toss into a smoothie and forget about. But researchers studying organ health have been paying very close attention to this particular fruit for a different reason entirely. Because two of the organs working hardest in your body right now, filtering, cleaning, balancing, may respond to what you eat in the evening more than what you eat in the morning. Stay with me, because by the end of this video, you're going to understand exactly why timing matters, what's actually happening inside your kidneys while you sleep, and which small, simple habit doctors keep coming back to when patients ask, "What can I actually do to protect these organs?" Here's something most people don't realize. Your kidneys don't clock out at night. While the rest of your body slows down, your kidneys keep working, filtering roughly enough blood over 24 hours to fill a small swimming pool. And what you put into your system in the hours before bed can influence how smoothly that overnight filtering process goes. That's where this particular fruit comes in. Not as a miracle cure, not as a magic pill, but as one of the most consistently studied foods when it comes to supporting the tiny structures inside your kidneys called nephrons. We're talking about blueberries. Later in this video, I'll explain exactly why the timing of when you eat them may matter, what the actual science says about kidney function, and one warning sign involving your urine that far too many adults over 45 dismiss as just getting older. But first, let's talk about why your kidneys deserve so much more attention than they get. Picture this. You're standing at the kitchen sink after dinner, rinsing a coffee filter before you toss it. That little paper filter catches grounds and lets clean coffee pass through. Your kidneys do something remarkably similar, except instead of coffee, they're filtering your entire blood supply over and over, all day and all night. Each kidney is about the size of a fist, sitting just below your rib cage on either side of your spine. Inside each one are roughly 1,000,000 tiny filtering units called nephrons. Their job is simple to describe but enormous in scope. Pull waste products and excess fluid out of your blood and send clean, balanced blood back into circulation. Most people never think about this process until something goes wrong. That's actually one of the tricky things about kidney health. Unlike a headache or a sore muscle, kidney stress often doesn't announce itself loudly. According to the CDC, a large share of adults living with reduced kidney function don't even know it yet, because early symptoms tend to be subtle or easy to explain away. That's the misconception we need to clear up right away. Many people assume kidney problems only happen to people who are extremely unwell, or that kidney health only matters if you have diabetes or high blood pressure already. But kidney function is something that shifts gradually over decades, influenced by hydration, diet, blood pressure, blood sugar, and yes, the foods you eat regularly, including how and when you eat them. So why are we talking about a small blueberry in the context of something this important? Here's an everyday scene. You're at the grocery store, and you toss a container of blueberries into your cart almost automatically, the same way you might grab a banana. You know they're healthy, but most people couldn't tell you exactly why, beyond a vague sense that berries are good for you. Blueberries are rich in compounds called anthocyanins. These are the pigments responsible for that deep blue-purple color, and they belong to a larger family of plant compounds known as flavonoids. Research published through nutrition science journals and reviewed by institutions like the NIH has looked closely at how these compounds interact with oxidative stress in the body. Oxidative stress is simply an imbalance between damaging molecules called free radicals and the antioxidants your body uses to neutralize them. Your kidneys, because they filter such a large volume of blood continuously, are particularly exposed to this kind of cellular stress over time. Antioxidant-rich foods, including blueberries, have been studied for their potential role in supporting the body's natural defense against this ongoing oxidative load. It's important to be clear here. Blueberries are not a treatment for kidney disease, and no food replaces medical care, prescribed medication, or regular checkups. What the research suggests is more modest and, frankly, more believable. A diet consistently rich in antioxidant compounds may support overall vascular and kidney health as part of a broader healthy eating pattern, alongside managing blood pressure and blood sugar. And that word, vascular, matters more than people realize. Your kidneys are essentially built around blood vessels. In fact, kidney health and heart health are so closely linked that the American Heart Association often discusses them together. Anything that supports healthy blood vessels throughout your body tends to support the blood vessels inside your kidneys too. Blueberries are also naturally low in sodium and relatively low in potassium compared to some other fruits, which is one reason they're often mentioned favorably in kidney-friendly eating patterns discussed by resources like the National Kidney Foundation. For most healthy adults, this makes them an easy, gentle addition to a daily routine. For anyone already diagnosed with kidney disease, portion and frequency should always be guided by a doctor or renal dietitian, since individual needs vary significantly depending on kidney function stage. Now here's where the evening timing piece comes in, and this is something people rarely explain clearly. Think about the last time you had a big, salty dinner, maybe takeout, maybe something at a restaurant, and woke up the next morning feeling puffier than usual, especially around your eyes or ankles. Most people blame that on sleeping wrong. In reality, it's often your kidneys working overtime to rebalance sodium and fluid levels while you sleep. Your body follows a natural rhythm when it comes to blood pressure and fluid regulation. Blood pressure typically dips at night in a healthy pattern doctors call nocturnal dipping. Some research has explored how kidney function and this nighttime blood pressure rhythm are connected, since your kidneys play a central role in long-term blood pressure control. This is one reason some nutrition-focused clinicians suggest that a small, antioxidant-rich, low-sodium snack in the evening, rather than something salty or heavily processed, may be a gentler choice for your body's overnight workload. A small serving of blueberries fits that description well. It's not that eating them specifically at 9 p.m. flips a magical kidney switch. It's that replacing a typical late-night salty snack with something like blueberries removes a burden rather than adding stress heading into the hours your kidneys are quietly doing their most important overnight regulation. If this kind of explanation is helping you understand your body a little better, consider subscribing. Every week we break down important health topics like this one in plain, honest language for adults across the United States who want to take better care of themselves without falling for hype or fear-based claims. Now let's talk about something a lot of people notice but explain away. Picture yourself in the bathroom in the morning, and you glance down before flushing. Most of us do this without even thinking about it. The color, clarity, and frequency of urination can actually offer real clues about hydration and kidney function. Occasional changes are usually harmless. Dark urine after a workout or lighter urine after drinking a lot of water. That's normal. But according to guidance from organizations like the Mayo Clinic and the National Kidney Foundation, certain patterns deserve attention. This includes urine that is persistently foamy or bubbly, noticeable swelling in the ankles, feet, or around the eyes that doesn't go away, unusual fatigue that doesn't improve with rest, or needing to urinate significantly more often at night than in the past. It's important to understand that any one of these symptoms, on its own, can have several possible explanations that have nothing to do with kidney disease. Foamy urine, for example, can sometimes simply be related to the speed of urination or diet. Swelling can come from sitting too long warm weather, or several unrelated conditions. That's why self-diagnosing from symptoms alone is never reliable. And it's exactly why doctors rely on simple blood and urine tests, rather than symptoms alone to evaluate kidney function. If you notice any of these patterns showing up consistently, especially together, or if they're new and persistent, that's the signal to bring it up with your healthcare provider. A basic blood test measuring creatinine and a simple urine test can tell your doctor far more in 15 minutes than months of wondering ever could. Let's step back for a moment, because blueberries are just one small piece of a much bigger picture, and I don't want you to walk away thinking one fruit is a complete strategy. Think about hydration first. Picture a glass of water sitting on your nightstand that you never quite finish. Consistent, adequate hydration throughout the day helps your kidneys filter waste more efficiently, since concentrated urine means your kidneys are working harder to manage less fluid. Most healthy adults are advised to aim for pale yellow urine as a simple, practical daily marker, rather than obsessing over exact ounces. Think about sodium next. Picture the salt shaker on a diner table, or the seasoning packet in a bag of instant noodles. The American Heart Association has long pointed to excess sodium as one of the biggest everyday stressors on blood pressure, and consistently high blood pressure is one of the leading contributors to kidney strain over time, according to CDC data. Think about blood sugar, too. If you picture a family gathering, a holiday table full of desserts, That's a good moment to remember that the American Diabetes Association identifies long-term high blood sugar as one of the most significant risk factors for kidney damage, since your kidney's filtering units are especially sensitive to elevated glucose over time. And finally, think about regular checkups. Picture a routine doctor's visit where blood work gets ordered almost automatically. The USPSTF and many physician groups recommend that adults with risk factors like high blood pressure, diabetes, or a family history of kidney disease get their kidney function checked periodically, even without symptoms, precisely because early kidney changes are often silent. None of this is meant to alarm you. It's meant to empower you. Small, boring, consistent habits, hydration, lower sodium, stable blood sugar, regular checkups, and yes, working in antioxidant-rich foods like blueberries are what actually protect these organs over decades, far more than any single miracle food ever could. Which point in this video surprised you the most? Maybe it was the connection between nighttime blood pressure and kidney rhythm. Maybe it was the urine changes worth watching for. If someone in your family has dealt with kidney concerns or high blood pressure or diabetes, feel free to share your experience in the comments respectfully. Conversations like that often help someone else who's quietly wondering the same thing but hasn't asked yet. Let's make this practical, because information without action doesn't help anyone. A simple approach many nutrition-minded clinicians suggest is swapping your typical evening snack, chips, crackers, something salty from a bag, for a small bowl of blueberries, maybe alongside a handful of unsalted nuts or a small serving of plain yogurt for protein. This isn't about restriction or deprivation, it's about replacement. You're not removing enjoyment from your evening, you're just changing what's filling that space. Fresh or frozen both count. In fact, frozen blueberries are picked and flash frozen at peak ripeness, which means their nutrient content, including those antioxidant compounds we talked about earlier, remains well preserved. If fresh blueberries aren't in season or are too costly, frozen is a completely reasonable and often more affordable choice. A typical serving is about 3/4 of a cup to 1 cup. That's a realistic, sustainable amount to work into an evening routine, not an extreme quantity, just a consistent one. And again, if you have an existing kidney condition, are on blood thinners, or have any concerns about how fruit intake might interact with your specific health situation, this is exactly the kind of question to bring directly to your doctor or a registered dietitian, since individual medical situations vary and deserve personalized guidance. So let's bring this together. Your kidneys work quietly around the clock, filtering your entire blood supply continuously, including through the night. Blueberries, thanks to their anthocyanin and antioxidant content, have been studied for their potential supportive role in vascular and kidney health, particularly as part of a broader pattern of eating that also includes proper hydration, lower sodium intake, and stable blood sugar. Replacing a salty evening snack with a small serving of blueberries is a simple, gentle habit that many clinicians point to, not as a cure, but as one small piece of a much bigger picture. And remember, symptoms like foamy urine, unusual swelling, or nighttime bathroom trips don't diagnose disease on their own. They're simply signals worth mentioning to your healthcare provider, who can run the appropriate tests and give you real answers rather than guesses. The most empowering thing you can do for your kidneys isn't found in a single berry. It's found in consistency, small, boring, repeatable habits practiced over years, not days. If this video helped you understand your body a little better today, a like helps us keep creating evidence-based health content like this for adults across the country who are simply trying to take better care of themselves. And if you've ever wondered what other everyday foods might be quietly supporting or quietly stressing your organs while you sleep, that's exactly what we're covering in our next video. I think you're going to find it just as eye-opening as this one. Take care of yourself, and I'll see you in the next video.